Hello, I'm Rachel from Keto Dream, and today we'll talk about keto, the best fatty liver diet. Fatty liver disease is exactly what the name suggests, a disease characterized by the buildup of fat in the liver. There are two main types of fatty liver disease: non-alcoholic fatty liver disease and alcoholic fatty liver disease, also called alcoholic steatohepatitis. Both types of fatty liver disease are diagnosed when fat makes up at least 10% of the liver, but the cause of the fat buildup is different for each type. The cause of alcoholic fatty liver disease is obvious. The amount of alcohol it takes to cause fatty buildup in the liver, however, is not so obvious. The Liver Foundation suggests consuming no more than 14 drinks a week for men and 7 drinks a week for women. Anything more than may cause fat to build up in the liver. The treatment for alcoholic fatty liver disease is simple enough: stop drinking alcohol. Studies confirm that cessation of alcohol consumption can reverse alcoholic fatty liver disease. However, the cause and treatment of non-alcoholic fatty liver disease are not as obvious. This is because many different factors, other than alcohol, can cause fat to build up in the liver. What causes non-alcoholic fatty liver disease? The exact mechanisms that cause non-alcoholic fatty liver disease are not fully understood, but we do know for certain that lifestyle, genetics, and gut health issues play an important role. Lifestyle. Insulin resistance is a common side effect of eating too much and exercising too little, and it is one of the main reasons why fat builds up in the liver. Throughout the body, insulin resistance causes fatty acids to be released from fat cells and sugar to build up in the blood. The excess fatty acids and sugar, from the blood and the diet, enter the liver where they are converted into fat and stored. As long as the liver, muscles, and adipose cells are resistant to insulin, sugar will continue to build up in the blood and fat will continue to build up in the liver. This vicious cycle of insulin resistance and fat accumulation in the liver is caused by eating too much and exercising too little. Genetics. Like many common diseases, non-alcoholic fatty liver disease is polygenic. This means that the interaction of many different gene variants can make someone more susceptible to having a fatty liver. One genetic variant, in particular, that is called PNPLA3I148M, is associated with the development of non-alcoholic fatty liver disease without the presence of obesity, diabetes, dyslipidemia, or insulin resistance. Gut health issues. Your microbiome is made of 100 trillion bacteria that line your gut. The types of bacteria that flourish or perish have a substantial impact on your health, especially the health of your liver. Studies done on the microbiome of obese patients found that they had a reduced abundance of a type of bacteria called Bacteroidetes and an increased abundance of another bacteria called Firmicutes. This ratio of Bacteroidetes to Firmicutes led to an increase in lipopolysaccharide absorption. The ketogenic diet may be the best fatty liver diet. Many studies conclude that caloric restriction is inferior to a low-carbohydrate, ketogenic diet when it comes to weight loss. For example, one study split 132 people into two groups: a low-carbohydrate diet, 30 grams or less of carbohydrates a day, group, and a calorie-restricted, low-fat diet group. After 6 months of this dietary intervention, the researchers concluded that severely obese subjects with a high prevalence of diabetes and the metabolic syndrome lost more weight in a 6-month period on a carbohydrate-restricted diet than on a fat and calorie-restricted diet. The ketogenic diet has also been proven in multiple studies to be more effective than a calorie-restricted diet at reversing type 2 diabetes, obesity, heart disease, and hyperlipidemia. This must mean that it is effective for non-alcoholic fatty liver disease as well, right? A recent pilot study put 5 patients on the ketogenic diet, less than 20 grams per day of carbohydrate. At the end of 6 months, the average weight loss was 28 pounds, but this wasn't the most surprising finding. Each patient underwent a liver biopsy, and 4 of the 5 patients showed a reduction in liver fat, inflammation, and fibrosis. This provides preliminary evidence that the ketogenic diet can reverse fatty liver disease and non-alcoholic steatohepatitis. Since you've watched the video until the end, I want to give you a gift that will help you speed up your keto diet results. You can get it in the description. Thanks for watching. If you like the video, consider clicking on the like and subscribe button. Hope to see you in the next video.